This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
All right, everyone, it's time to take a step outside of that comfort zone. We're going to talk about something that's probably doesn't come up in your everyday conversations, yet it's something we all do several times a day.
Many times you go to the bathroom. Yeah, we're going to go there. Now, you may not realize the color and even the smell of urine can say a lot about your health. So joining us today to tell us exactly what is so important, Dr. Mark Edney. He's a urologist and chief of surgery at Peninsula Regional Medical Center. Thank you so much for joining us today.
Thanks again.
So urination, it's important to our overall body health.
Absolutely. It's a critical bodily function. We all do it. We all have to do it. Our kidneys filter our blood constantly to keep our salt balances in order, to manage our fluids. If we don't have enough water in our bodies, the kidneys hold on to it. If we have too much water, the kidneys get rid of it. And it's also important filtration mechanism to get rid of a lot of different types of waste. So it's a critically important bodily function.
So how many times a day should we be doing it?
It's a great question, and there's no right answer to that. There's actually a range of normal. Some people go every 3 or 4 hours, others more often or less often than that. I would say, as a general rule, if you're only going once or twice a day, that may not be enough, and you should probably be evaluated. More often, we see people in the office with complaints of going too often. Frequency is a very common complaint. I go every hour. I'm up, 3 or 4 or 5 times at night to go frequently, and there's a whole variety of different potential contributors to those sorts of issues. But there's no right answer. There's a range of normal, but if you're well outside that range, you should probably be evaluated.
So part of it could actually be trying to hang on to it.
It can be. It can be.
Because people, don't like to use certain restrooms. I know my kids sometimes in school, they didn't want to go to the bathroom at school, so they would hold on to it.
Absolutely. It's actually particularly an issue sometimes in young girls in particular that tend to have holding behaviors, leg crossing and those sorts of things where they consciously hold on because they don't want to either void in public or they're embarrassed in school or those sorts of issues. And that can lead to a whole other host of issues in the urinary tract. But yeah, the holding behavior sometimes is a problem.
Well, you mentioned that. How about how we urinate? Are there any signs we can look for to indicate there might be a problem?
It's a good question, and the answer is different for men and women because men have a prostate below their bladder that oftentimes can start to cause blockage with time. Right. And so symptoms that might come up are slow stream, starting and stopping of the stream, difficulty initiating the stream, or getting up at night. Those are some complaints that men might have. Women don't have a prostate, and so there's a pretty clear route out of the bladder, but that's not to say that women don't develop urinary complaints. More commonly in women, we see what's called overactive bladder, where you might get some frequency and some urgency. And as women age, in some cases, the bladder stops squeezing as efficiently, and so the bladder doesn't empty as well. And so they may complain not only of frequency and urgency, but a sense that they're not emptying their bladder very well. So if any of those symptoms come up, they really ought to come in and have an evaluation.
Now, the color of our urine is important too, right? We need to kind of pay attention to that?
Absolutely it is.
What might we see and what might it mean?
So most of the time urine is some shade of yellow, and ranging from pale yellow to clear all the way up to dark yellow and almost an amber. And most of those variations really have to do with our hydration status. It's how much water you're getting in during the day. Folks will recognize, particularly in the summer when it's hot, we perspire, we lose a lot of body water without even knowing it just by being in hot weather. Right. That dehydrates us, and often folks, if you're not catching up with your water intake, you'll notice in the summer when it's hot, when you urinate, it might be a darker yellow or amber. However, once you get enough water, it often moves towards the clearer side.
Now, I've always heard that the clearer the better. Is that the case?
Yeah, generally, yes.
Okay.
The clearer the better. I generally counsel my patients that urine should be light yellow or clear, particularly important for stone patients. People who've had kidney stones before, one of the main instigating factors of forming a kidney stone is an episode of dehydration because those salts that form stones come together easier in a concentrated urine. So I counsel those patients to keep their urine light yellow or clear to avoid stone problems.
Brown is usually an indication that you're dehydrated?
Brown's is a separate issue. There's a dark amber that can come up, which is a dark yellow, but there also is brown urine. That's a whole different story. One of the more common causes of brown urine is old blood. If you develop some blood in your urinary tract, it may be pink or red to begin with, but blood that sits in the bladder for a while actually turns brown, and you may urinate and see a brown color. So old blood is one thing. Liver disease, and there are some other metabolic conditions that can lead to a brownish color of urine, but it's unlikely if you have a liver problem that the brown urine is going to be the first symptom. These are mostly real sick patients in the hospital who've got a variety of other problems going on and the brown urine. So it's not something you're probably going to notice in your day-to-day observations.
So what about pink to red?
So pink to red may indicate blood in the urine most commonly, and that's something that absolutely needs to be evaluated. There are some instances where blood in the urine can be normal, some inflammation or something else that's not a concern, but everyone who has blood in the urine ought to get a full evaluation from the kidneys all the way down to the end of the urinary tract to rule out significant things like kidney stones, bladder tumors, kidney tumors, other concerning issues that can cause blood in the urine.
And there you can actually have blue or greenish color urine.
Blue or green is actually possible, and we see it. It's very rare. There are some rare metabolic disorders that can cause a blue or greenish tint to the urine. They're very uncommon, but certainly if you're noticing that, we should take a look.
Okay, so what we eat can impact our urine.
Absolutely it can. Not only the foods we eat, but a lot of the medicines that we take can affect the color of the urine and in some cases the odor. But there are lots of different foods that can affect the color. Probably one of the more common is I'll have patients come in or describing that their urine is a neon yellow color. And that's vitamin B2. It's a vitamin called riboflavin. Very common in a lot of foods we eat. It's in milk, it's in cheese, it's in leafy green vegetables, some meats including beef, and fish. So it's very common in our diet, and in high amounts can cause a very bright neon yellow color. A lot of people take a multivitamin, so B complex vitamins also contain a lot of riboflavin. So all of those can really enhance the yellowness of the urine.
So there's actually, sometimes our urine can smell a certain way depending on what food we eat.
Absolutely, and probably one of the most common examples that people are aware of is asparagus. And it turns out asparagus has a chemical called, appropriately enough, asparagusic acid. And what our body does to asparagusic acid is it breaks it down into 2 or 3 byproducts that contain sulfur. And if you ever have smelled the sulfur, it's a very pungent odor. And that's what people describe their urine smelling like after they eat asparagus. This is a chemical that gets into the urine and then vaporizes as you urinate. And so it's very quickly identifiable to a lot of people who have eaten asparagus.
What if it looks cloudy?
Cloudy is a great question. It's a very common complaint, and it's not always infection. Usually people are very concerned, well, it's cloudy, I must have an infection. In some cases, that's the case. Most of the time, if there's infection present, it'll also have a very pungent, foul odor to it. You can have cloudy urine and have no odor. In most cases, Jimmy, that's phosphates, dissolved phosphates. And again, a byproduct of our metabolism. When we eat food, we break it down, and phosphorus is a common metabolite. It gets into the urine, and depending on what we call the pH of the urine, that's the acid content of the urine, if the pH is low enough, those salts actually form solid material, and it can form a cloudiness to the urine, but that's dissolved phosphate most of the time.
How about that? Well, the bottom line is if you have any questions about your urine, talk to your doctor. Thank you so much.
Very welcome.
It's very interesting information, and if you'd like to read more about PRMC or to read more about what the color of your urine can say about your health, go to delmarvalife.com and click on the show tab.
Okay, so that's one area of your body that can reveal problems with other parts. Another indicator, your feet.
Yeah, still ahead on Delmarva Life. Your feet hold up the rest of your body, so it stands to reason. Foot problems can create problems in the rest of your body. We'll show you a simple way to know if that's the case.
Okay, so from your feet, let's go to the other end. Does it feel like your arms sometimes just aren't long enough to be able to read your cell phone? Admit it, you know what I'm talking about. Maybe the solution can be found in a smartphone app. Delmarva Life, we'll be right back.